Good morning and welcome to Member Focus Monday. I'm Christina Schaefer, Director of Social Media for HAR. And with May being Mental Health Awareness Month, we thought right now is a great time to bring on Dr. Asim Shah with Baylor College of Medicine to discuss mental health and ways to serve your clients, but also to protect your mental health. So welcome to the program, Dr. Shah.
Thank you. My pleasure to be here.
Thank you so much. So we want to jump right into it and talk about some best practices and tips and resources that you also have. But if you could just, before we get into all of that, tell us a little bit more about yourself.
Sure. So I work at Baylor College of Medicine, like you said, and I am a professor there and executive vice chair. Also, I'm a chief of psychiatry at Bent Hop. With all these roles, of course, I see a lot of psychiatry, a lot of mental health. And Houston has a lot of resources for mental health for people who have insurance and people who don't have insurance. So that's something I want to emphasize, that you will see a lot of people who may not have insurance, but still resources are available. And we can talk about somebody needs to. So don't worry, resources are available for you whether you have insurance, money, or you don't have insurance.
Wonderful, thank you, and we will definitely look forward to those resources. So the last 2 years, I think we're putting it lightly by saying they've affected us all in some way. Based on what you've seen, how have the last 2 years affected people's mental health?
Yeah, last 2 years have been very stressful for everybody. Mental health has been, of course, the most in terms of people's mind or so. And if you see, it has been in phases. 2020 was worse in the sense that people had isolation. If you recall early images of 2020, you were not supposed to see your elderly parents or grandparents or anybody. A lot of social isolation, starvation. People were not hugging, not shaking hands, and touching and hugging causes a lot of help. We didn't realize it before, but now we know that touching and hugging releases oxytocin, releases other neurotransmitters, which help in your immune system and relieves your stress. So we took touching and hugging for granted, but we realized with COVID that that's also a blessing. So 2020, like between March and September, stressful time during that. A lot of people were anxious, phobic, panic, depression, PTSD. But after September, things started getting a little better, especially in Texas, and especially after December when vaccines came, things got better. Right now, our biggest worry is kids. Kids still have a lot of issues and will continue to have, unfortunately, a lot of issues. So if we think about the trajectory, anxiety, depression, 30 to 40% increase, PTSD, also child abuse. In 2020, we saw a significant increase in child abuse, intimate partner violence, but the reported cases were less because the aggressor or perpetrator was at home, so people were not reporting. Whereas schools used to report those cases, but schools were initially closed. So that was also a different thing. And emergency room visits have increased 30 to 35% for mental health issues.
Wow. Yeah, so those are some startling numbers, and as you said, with people being stuck at home,
Yeah,
it might have been higher because it wasn't being reported.
right,
Um,
right,
Go ahead.
exactly.
Yeah.
Yeah,
So
and suicidal thoughts were also high.
yes, absolutely. So most of the time that you ask somebody how are they doing, and the general response is I'm fine. Why is it important, and how important is it to open up to someone you trust and express when you are going through something stressful?
That's, that's a very important question because when you ask somebody how you're doing, the usual response is a mechanical response, I'm fine. I do that too. Everybody does that, even if you're not fine, because that's a mechanical response. Our body or our mind is kind of already automated. You give that response. So you need to judge, or not judge, judge is a bad word, but you need to kind of look into a person's emotions, body language, things, how they're doing. And some warning signs for certain mental health illnesses could be a person who's withdrawn, a person who seems burned out, a person who is not doing things they used to do, not enjoying things they used to enjoy. And if you want, I can share some of those warning signs with you. I think I can share the screen, right?
So we can't for
Let
this
me share
program,
some
but
of
yeah.
those. Okay, we can or cannot.
Well, if you can do it easily, go for it. But it might be difficult. So, but go ahead and if you can,
No, I
yeah,
think no, it's not going to let
yeah.
me. Okay,
But that's okay.
so what that a person who's yeah, person who's withdrawn, a person who's staying at home, a person who is not doing things which they used to do, not enjoying things which they used to enjoy. Meaning, the routine is changed, and when you see that, that's the time you need to talk to them. You need to ask them what's going on, what are they doing, are they feeling sad, depressed. And if that is the case, you need to get them some help, some attention. Another warning sign is a person who used to drink a little bit, they're drinking more. They used to do a little bit of drugs. All the drugs are not good, but still used to do a little bit of that, maybe doing more than that. So anything which is out of the ordinary, please get them some help, and help is available.
Okay, and that's good. That's good to watch out for those warning signs. So, generally, what do you recommend to patients that might be going through or undergoing heightened amounts of stress or anxiety? You know, I think people tend to manage the day to day stressors for the most part, but sometimes, again, we experience things, we're going through different things, or you might be helping somebody through a very difficult transaction and you have heightened amounts of stress. What do you recommend to those people?
Yeah, usually what I recommend in terms of managing stress, I call it 7 E's. And the 7 E's are first is exercise. Exercise helps tremendously. If you exercise 30 to 40 minutes, at least 6 days a week, that helps tremendously reducing your stress. Second E is express yourself, meaning don't bundle down your emotions. You need to express your emotions to somebody you trust, not to somebody you don't trust who's going to make fun of your emotions. So it
Right.
has to be somebody who you trust. So exercise, express. The third E is enjoy. So enjoy things, what you do, whether it's eating a certain meal or going for a long drive or watching a movie or you know listening to music you like. Fourth E is explore. Exploring things which you like going for hiking or going to a museum. Fifth E is engaging in certain things, engaging with family, engaging with a friend. And sixth E is energizing yourself with whatever you want to do. And last is seventh E is eating healthy, not eating the stuff which is not healthy. So if you do the 7 E, that always helps in reducing or managing your stress. Those are the 7 E's which always help. Now, remember one thing about stress. Stress is not all the stress is bad. There is a positive stress also, and stress is something which is a little bit of stress is good for you because stress is a motivator. Think about it: if you have an exam due, or if you are going for a sports match or something, if you're not stressed, if you're completely relieved, perhaps your performance won't be as good. So a little bit of stress, positive stress, gives you motivation to do better, and you perform better. So a little bit of positive stress is all, but of course, we don't want you to be too stressed.
Yes, absolutely. A couple comments coming in. Dan said, health is wealth. And we couldn't agree more. When you mentioned the first E, exercise, Lisa said she is at the gym on the treadmill right now watching this program. So that's wonderful.
Perfect.
Very good. So again,
That's very good.
our members are helping people every single day. They serve as counselors to their clients. What recommendations do you have for them? How can they best assist their clients, but also take care of themselves? Because as you might know, Dr. Shah, we have over 47,000 members. So a lot of times realtors might feel like, well, if I don't answer this phone call right now, if I don't jump in the car to go help this client, I might lose this client. So how can they set those boundaries and what recommendations would you make?
You're absolutely right. And somehow we, the clients, because I have been a client myself multiple times, we, the clients, feel that you can call the realtor any time of the day or the weekends because that's just the way, unfortunately, business works, sadly. Uh, so I think the first thing is I always give the example of airplane. When you go in a plane, what do they tell you? They always tell you that in case of a low oxygen, always put the mask on your face first or yourself first, then your child. And actually, sometimes people, why not my child first? Because I love my child so much that I want to do that on my child first. And the simple reason is that if you are unable to take care of yourself, you cannot take care of anybody else, right? So
Mm-hmm.
the same example applies here that please take care of yourself. You need to take care of yourself. You need to be in best health. You don't need to burn out. And if you are in best health, you can take care of anybody else. So, first, take care of yourself. You are most important. If you are in good health, good shape, good mental health, and able to take care of yourself by doing whatever you do, whether it is 7 E's to manage stress or whatever you do, then you can take care of your clients and others. So don't put your health at risk by taking care of others and not yourself. That's the first thing. Second thing is if you feel your clients are at risk and they need something, give them the tips, give them the resources. Don't be their doctor, don't be their therapist because it's not good, but give them the resources, and if you want, you can even help them connect with the resources, but give them the resources so that they can get help. That is the best you can do. The problem with mental health is that nobody can force anybody to get mental health. Sometimes you feel that so and so is paranoid, or so and so is anxious, or so and so has personality issues. They may have that for years. They're not getting help. What can you do? Perhaps nothing, sadly, right? And you force them, they get even more upset. So try to get them help or resources by giving them resources. That's the best you can do.
Wonderful. So you mentioned the 7 E's. Is there anything, maybe somebody watching this program, maybe if they're feeling completely just overwhelmed right now, aside from those 7 E's, what is something else that they could maybe do to feel better?
Sure. There are multiple things you can do. So let's start stepwise. If you feel mildly anxious, mildly depressed, there are multiple apps you have. Um, this is a digital, technology type, right? So
Mm-hmm.
people want to go anywhere. They want to just do everything at home. So if you want to do things on your phone, there is an app called What's Up. Not WhatsApp. Everybody knows WhatsApp, but it's What's Up.
Mm-hmm.
UP. It's a CBT app for depression and anxiety. It's a free app you can download, and that will help you depression and anxiety. Then there is another app called Mood Kit, also a CBT app for depression anxiety that will help your depression and anxiety. Then there is an anxiety app called SAM, Self Help App. You have PTSD Coach, you have Intermind, which is a Spanish language app, you have Liberate, which is for African American diaspora, uh, you have Mind Shift for kids with anxiety. So you have multiple apps which are available. Now, these apps are for mild symptoms.
Mm-hmm.
When you go more severe, then you have COVID mental health support line. And I'll give the number and you all can write it down. It's a 24/7 COVID mental health support line in the greater Houston area. And the number is 833-986-1919. 833-986-1919. Then, if you live in Harris County, you can go to Harris Center. If your income is 100% of federal poverty level, which is about 14,000, they will see you free. If your income is between 14 and 19,000, 50% of federal poverty level, you can go to even Harris Health, meaning Bent Harbor. They will see you free, but you have to live in Harris County.
Wonderful.
If you live in Fort Bend County, you can go you can go to Texana, and they will treat you free if your income is less than 100%. Of course, if you have insurance, you can go to multiple providers.
Mm-hmm.
There are other providers which will see you like Ibn Sina or Legacy. And lastly, if somebody is having crisis or suicidal thoughts, that number is really important to remember. That is 1 800 273 TALK. 1 800 273 TALK. That's a 24/7 number. They pick up the phone, they will divert you to wherever you need to go. And there are two psychiatric emergency rooms in the city. One is at Bentop, and the next is adjacent to Bentop called NPC. So those are the resources. So again, mild symptoms, you can do some social media free apps. Moderate symptoms, you can go and see somebody. Severe symptoms, of course, go to the ER or 1-800-273-TALK.
Wonderful. And thank you for sharing all those resources. We did put a lot of links in the comments. So if anybody missed those links or needs those links, we do have those and the phone numbers you mentioned there. So we appreciate that, Dr. Shah. I had a question for you for specific to parents or caretakers, maybe taking care of an elderly family member or anything like that, that might be watching this program. What can they do to help those loved ones take care of their mental health? It was also a question that came in. Jenny was asking, what are the top signs for somebody who might be struggling, and
Yeah,
how can you tell when they might need to seek professional help?
yeah. First, let me answer Jenny's question. The top
Sure.
signs will be change in their behavior. So if the behavior changes, their normal routine changes, they're doing things which they were not doing before, that's something to worry about. So deviation from their normal behavior, normal day-to-day activity is a top sign. Getting withdrawn is top sign. If you think about depression, one symptom of depression to always remember and be careful about is lack of interest. Sleep is non-specific, appetite is non-specific, concentration is non-specific, but interest is the most important key. So if somebody loses interest in life, feels anhedonic, which is what we call helplessness, hopelessness, that's the key. That's where you get them the help. So that's the top sign that somebody's going through severe depression if you're talking about depression. Now
Okay.
you're talking about elderly person and how to care for them. We miss the most important illness in health, which is dementia. Dementia is short-term memory loss, and a lot of time we feel that our elderly parents or grandparents are fine, and their memory is great. Especially when we ask memory signs and symptoms, most of the time answer is, "Oh, my father is great. His memory is so good. He even remembers what happened in 1960." Guess what? They remember what happened in 1960. Do they remember what happened last night or last week? And usually the fact is they may not happen last week, but they may remember what happened in 1960 or 70. So those are early signs of dementia, and which is very common and it's age related. The more your age, the more the chance. Every year after age 65, the chance increases, and after 85, it's more than 50% chance. So we need to make sure that our elderly parents or grandparents, if they have dementia, we get them help. Help meaning they need to be with a caregiver. We need to have medical power of attorney, other power of attorneys. They may not be able to drive. They may not be able to cook because they can burn things. Imagine if they don't remember, they may turn the gas oven on, and what if something burns and the whole house? So a lot of things can happen. So we need to be very careful. And caregiver burden is a lot. So you just need to be careful, especially with elderly parents and elderly family members.
Wonderful. And you mentioned with children that there's specific apps for children as well. I think you said it was the Mindset
Right.
app. Was that the name of the app?
Yeah, yeah. Yeah, there are multiple apps for kids. So the specific app for kid, so I talked about Talkspace and others. So what you can do for kids, you repeat the apps again for kids. So specific thing for Mind Shift is the app for kids with anxiety. It can be used for that. Others can be used for kids also, but Mind Shift is specifically kids with anxiety.
Okay. Very
And these
good.
are all okay.
And they're all free apps. Wonderful. Yes, and I see
All free.
people are sharing the 7 E's in the comments as well. So thank you for sharing those 7 E's for our viewers. They're definitely writing them down. So hopefully those can be of some help. Well, Dr. Shah, we again with it. It's always an important time to talk about mental health. With it being Mental Health Awareness Month, we just thought this was a perfect time, and this is something that our members have been asking for quite some time for us to bring on another mental health expert, because it is a lot that realtors have to do just in their personal lives, but also with assisting and helping clients. So this is really important. Is there anything else that you'd like to share with our members today?
Only thing I would like to share is that do not hesitate to talk about mental health. Mental health is a lot of stigma. Even the word mental health has stigma in it. So please don't hesitate to talk about it. It's okay to talk about mental health. It starts by only talking about it. And don't feel that mental health is something which is like a magic that it will get better. The biggest problem with mental health is that people will take medicine 3 weeks, 4 weeks, 1 month, 3 months, and they will stop the medicine. And then unfortunately things will recur. You don't do that with diabetes. You don't do that with hypertension. You don't do that with asthma. Why do it with mental health?
That makes perfect sense. Well, again, Dr. Shah, thank you so much for your time today. We truly appreciate it, and I know our members are thanking you right now for this discussion today. So we appreciate it. So I want to go ahead and let our members know that next Monday we will have Leslie Rhoda Smith, who is the NAR president of the National Association of Realtors. So we're going to be hearing from her on all of the updates from the National Association of Realtors. So be sure to mark your calendars for next Monday. And again, Dr. Shah, thank you so much for your time today. That is it for this Member
My
Focus
pleasure.
Monday. I hope you all have a wonderful week. Bye-bye.